discharge teaching to a patient going home on Apixaban. So start off with the generic name is obviously Apixaban. And the most common trade name here in the US is Eliquis. The rationale for use, or the reason behind using such an anticoagulant, is usually to prevent a clot or clot formation in people with high risk conditions, such as uncontrolled heart rate in AF, or even controlled heart rate if the patient is high risk, patient who have recurrent DVTs or hypercoagulable state and need the blood to be thin at all times. It can also be used in active treatment for thrombus, as in DVT or PE. In DVT, to further prevent any pulmonary embolism, and it can also be used in pulmonary embolism itself. The mechanism of action, it's a direct factor 10 inhibitor. Factor 10 is the coenzyme that acts on the prothrombin to change to thrombin, and then the thrombin change the fibrinogen to fibrin, and then the clot formation happens. So Apixaban will inhibit the factor 10, which will inhibit the prothrombin to change into thrombin. When it comes to doses, usually Apixaban is dosed on multiple factors. One is age, second is weight, and the third is renal clearance, and specifically renal clearance. And we will talk about that when we talk about the contraindications. So these three factors would definitely guide the dose, but also the diagnosis and how bad the diagnosis is as well. But usually the doses is from 2.5 to 10 mg BID. Apixaban adverse effects, the most common seen, or the non-specifics, are nausea, headaches, and dizziness. It can cause confusion in old people. It can cause in young people as well, but more common in old people. And of course, bleeding is one of the of its effects, but it can also be an adverse effect. And it can also cause elevated liver enzymes. Some of the special considerations for Apixaban, so it can be taken with or without food, and if a dose is missed, you can still take the missed dose as soon as you remember, and then continue with the regular schedule, which is twice daily. And when it comes to personal hygiene, you will need to have a soft brush for your teeth, avoid nose picking or forced nose picking, nail trimming, try to be gentle and don't cut skins or extra skin, and avoid any contact sports or vigorous exercise that can cause injury or trauma. Or any activities that can increase the risk of bleeding. And you will need to contact the provider in any case of bleeding. If you suspect bleeding from any site, like the mouth, the nose, in the urine, in the stool, which might come as black stool or fresh red or different, sometimes dark red. So any bleeding coming out of any opening, or simply any bruising, contusions, you need to contact your healthcare provider. You need also to tell your provider before any dental procedure or medical or surgical procedure. And if you're using a new drug, or whether it's an OTC or a prescribed drug, it's better to tell the provider that you are on Eliquis, so consideration will be made, because a lot of drugs can interact with Eliquis, whether increasing its effect or decreasing its effect. And one of the important things to consider when it comes to Eliquis is renal function. Renal function needs to be followed, and again, because one of the main contraindications is chronic kidney disease with GFR more than 30, And the other major risk factor is bleeding, active bleeding or increased risk of bleeding, and that can be divided into absolute contraindication and relative contraindication. And thank you.